I'm now going to introduce, again, with very brief introductions, the next three speakers. They'll come up and sit here and then make their comments. First is Rick Johnson, who's the president and CEO of the Governor's Foundation for Health and Wellness, which is a nonprofit corporation that's leading and directing a statewide initiative, the Healthier Tennessee Initiative, that many of you all know. I'll go ahead and ask the other two speakers to come up as well and just sit here at the table. Dr. Teresa Kidd is the president and CEO of Frontier Health and a licensed psychologist with over 35 years of experience in misplacing their introductory material. Frontier Health is the region's leading provider of behavioral health services, substance abuse issues, and so on. And I think we heard earlier the importance of integrating mental health and primary care. And then Richard Venable is recently returned to his post as the Sullivan County Mayor, the former member of the Tennessee House of Representatives, and more recently served as the CEO of the Sullivan County Partnership. I think, again, three more really distinguished speakers, and I'll turn it over to Rick and then let him pass the microphone down. Thank you.
First of all, I want to say thank you. It was a lot easier for you to maybe roll over in bed and get a few more minutes of sleep on a really cold, frosty morning in Upper East Tennessee than it was to come out and be part of this. And I'm really grateful that you're here. Because as Dr. Wyckoff said earlier, this is really all about what we can do together, not about what any of us can do individually. I want to basically spend a very few minutes and hope you go away with feeling two ways. I hope you go away feeling really scared and really upset, frankly. And then I hope you go away feeling hopeful and charged up to do something. What I want you to be scared about and a little bit, and a lot concerned about, is that we do have a health crisis in Tennessee. And we maybe even have a greater health crisis in Upper East Tennessee. We are in the bottom 10 compared to other states, as you heard talked about earlier, and we have been for the last 2 decades since these statistics have been compiled and shared. And it's not getting better, it's getting worse. The rate of obesity in this state is growing at 2.5 times the national rate of obesity. Almost 70% of us are either overweight or obese, have a BMI of 25 or greater. Almost 70% of us. 37% of us say we get no exercise at all. We lead a completely sedentary life. Almost 1 in 4 of us. Almost 40% of us. 1 in 4 of us says we smoke, if we're an adult in Tennessee. That's self-reported. That doesn't include smokeless tobacco, and those rates are higher in many of the counties of Upper East Tennessee. And worse than that, if we're teenagers in Tennessee, 1 in 5 of us still smokes. And that's self-reported, and that's not including smokeless tobacco. 1 in 8 people in Tennessee, 1 in 8 adults, has type 2 diabetes. It's among the highest rates in the country. Diabetes is a terrible disease to live with. And it leads to a lot of really awful health conditions that are expensive and painful and cause a lot of suffering and eventually can lead to premature death. We have almost epidemic rates of hypertension and stroke in this state. We have extraordinarily high rates of cardiovascular disease. Because of our smoking rates and for some other reasons, extraordinarily high rates of COPD and asthma. All of these things are unacceptable things to be going on in a state as great as this is. We're too good for this. And we need to be really concerned about it, and we need to understand the platform's on fire. The platform's burning. It's not okay, and we have to do something about it. So I want you to really understand that. But I want you to understand we can fix this. I want you to understand that we can turn this around and do something about this. This is something that we can directly affect. You know, I think all of us feel related to health that there are an awful lot of things that we're at the mercy of somebody else for. You know, we count on our physicians and our healthcare providers for care, and it's up to them to provide that to us. We count on our employer to provide some sort of way to help us to be able to afford health care. We count on our government to provide help if we need it with health care, and we don't always see that happen. We don't always get that when we want it or need it, and we're not always in control of it, and we've seen an example of that this week. But there is something that we have a very direct ability to control, and I think we ought to feel good about it, and I think we ought to be encouraged that there actually are some things going on that we can all be a part of related to that. One of those is the Governor's Foundation for Health and Wellness that I'm privileged to get to be part of. It was started in 2013 by Governor Haslam, who had determined that health and wellness had to be one of the top 3 or 4 priorities of his administration, along with education and jobs creation and economic growth and more effective, efficient government. Health and wellness is a priority of this administration. And as we began to look at what's that, as he said, okay, that's a priority now. How are we going to address that? How are we going to make this, how are we going to make a difference in Tennessee relative to this? And he asked me in early 2013 if I would leave the private sector and come and work on how we address this. And early on, the decision was made that this could not be just another government program, that it had to engage the private sector, and that it had to be a coalition of the willing, a coalition of stakeholders from all over Tennessee who would come together and focus on how we would get Tennessee out of the bottom 10 and improve health outcomes in the state. And we have set about doing that since early in 2013, first with the creation of the foundation so that the private sector could be very involved in how we do this. So healthcare providers and health insurance companies and employers like Eastman and others all across the state, faith-based organizations, civic organizations, chambers of commerce, United Ways, people like Dr. Wyckoff and others from higher education have come together, formed this coalition along with the foundation to address this. We're basically asking people in Tennessee to band together and do 3 fundamental things related to their health that we all can take charge of and really make a difference. One, we all can be more physically active. Most of us are not going to run a marathon. Most of us are not going to turn into Olympic athletes overnight, but we all can take a walk for half an hour a day. We can go for a bike ride. We can go for a swim. We can get in 30 minutes of physical activity at least 5 times a week, and that will make a huge difference in our health outcomes. We can eat better. We can be a little better about what our diet looks like. That does not mean a radical diet, and it doesn't mean that you got to lose 1/3 of your body weight in a week or 2. That's not going to happen. You know, it means you need to eat more fruits and vegetables, watch portion sizes, and don't drink so much sugar as many of us do. And then finally, we need to abstain from tobacco. It kills us. It shortens our life. It makes life miserable. And there's a lot of help out there to quit if you're using it. And Lord knows there's lots of reasons and information and education about why you should never start to begin with. So be more physically active, eat healthier food and control portions, don't use tobacco. That's something we can all make a difference about, something we can all do. We're trying to get people to do that. There are 6.5 million of us in Tennessee. There are 9 of us in the foundation. We need a lot of help, to make this happen. So we're very focused on the places where Tennesseans come together in the largest numbers, where they're in community, where we work, where we worship, and where we learn. So we need to see as many of you who are leaders and influencers in workplaces to have the workplace wellness, like Mark and like Perry we're talking about this morning. We need you as members and leaders in faith communities to have your place of worship make being a part of that congregation be healthier, and make health and wellness from a physical health standpoint be as important, or at least a part of what it's like to be in that congregation as spiritual health is and spiritual wellness is. And then finally, we are working to get kids in our schools more physically active, eating more nutritious food, and understanding the importance of all of that, and we need your help there too. There are tools available through the foundation. If you want to start a wellness program in your workplace or your faith community, there are tools on our website at healthiertn.com that will help you do that. However you do it, go to the Y, use your own resources, use whatever method you can. Help us to be leaders in making that happen where you work, where you worship, and where you learn. Final thoughts. 3 fundamental things. We can do this. We have it within us and within our power, without waiting on the government, without waiting on anybody else but each other. We can do this. We can do it with each other and one step at a time. It's not going to happen overnight. We don't have to turn our lives upside down. We have to take some small steps, keep taking them, and incrementally they lead to big change that will eventually get Tennessee and Upper East Tennessee out of the bottom 10 and make our place that's such a wonderful place to live a healthier place to live. Thanks.
Okay, Christian, which one? And this one? To forward? This one? The other one. This one, okay. Good morning. Thank you very much for the opportunity to be here today. I'm Teresa Kidd. I'm the CEO, President of Frontier Health, and I would like to especially thank Dr. Wyckoff for inviting me to be present today. Oftentimes when we have healthcare forums and discussions about healthcare outcomes and healthcare costs, behavioral health is not at the table. And I hope after my brief presentation today, you'll understand the need for behavioral health to understand its impact not only on healthcare outcomes, but its potential impact on healthcare costs as well. So I really appreciate the opportunity to be here, talk a little bit about the impact of behavioral health. It's been intertwined in everything that's been presented so far today. Frontier Health is the largest provider of behavioral health services in the 8 counties of Northeast Tennessee and the 4 counties in Southwest Virginia. We have 64 locations, and we serve approximately 52,000 individuals each year. 52,000 individuals each year in this region. We have an employee base of about 1,025 employees. That ebbs and flows, but it usually stays around there. Many of the individuals that we serve have serious and persistent mental illnesses, substance abuse problems, or intellectual and developmental disabilities. Currently, Frontier Health has over 14,000 active cases in Tennessee, and we have approximately 33,000 cases in Virginia. Here's just a brief glance of some of the services that we offer at Frontier Health. And although you see some of the traditional services that are available, there are also some uncommon services that you would think of with a behavioral health agency. For example, we do have a domestic violence shelter. We also offer psychosocial rehabilitation and peer support services. We have a small program for homeless outreach that works with families who are in danger of losing their homes who have children. All those things are connected to economics, they're connected to poverty, they're connected to a variety of things. But you see we have a host of specialized and fairly traditional services. So of the approximately 14,000 Tennesseans that are in our services and another 3,300 that are Virginians, approximately 18% of those individuals are uninsured. These individuals receive a variety of services, therapy, medication management, community-based outreach, or case management services. Over the years, Frontier Health has made a commitment to providing services on a sliding fee basis to those individuals who have no income or who have no insurance to pay for their services. We've been able to do that because of the contributions of local governments, United Way contributions, and grants that we're able to bring in. As most of you are aware, the financial burdens facing most local governments has created a situation where our local funding for services for the uninsured has either been drastically reduced or in some cases totally eliminated. Being able to provide treatment to the uninsured population is becoming more challenging, but I can assure you that the need for treatment has not decreased. The impact of behavioral health is fairly significant. Behavioral health conditions are not rare. 1 in 5 individuals suffer with a behavioral health condition. Behavioral health conditions are chronic in nature. These conditions, according to the National Institute of Mental Health and the Agency for Healthcare Research and Quality, indicate that behavioral health conditions lead to healthcare costs that rival the cost of cancer in the United States. There's a huge economic impact of behavioral health conditions. Mental illnesses such as depression can lead to significant disability and lost income, and mental illnesses frequently accompany physical health conditions. If we look at some of the comorbidity factors, at least 50% of individuals receiving primary care services have a behavioral health comorbidity. Failure to recognize and appropriately treat behavioral health conditions will have a significant impact on those healthcare outcomes and on healthcare costs. If left untreated, we see an increasing utilization of medical resources. You have increased hospitalization, more frequent readmissions to the hospital, high utilization of emergency room services, and decreased treatment compliance among this population. Healthcare costs are 2 to 3 times higher for individuals with comorbid mental health and substance abuse conditions. One of the most telling statistics about the impact of behavioral health conditions on the overall health of our communities and our nation is this statistic. People living with mental illnesses are dying 25 years earlier than the rest of the population. And unlike what some people think, it's not because of their tendency towards suicide or their suicide statistics. It's because of their unmanaged physical health conditions, because of their comorbidities. This population has difficulty with life stressors. They have difficulty handling life stressors. They often have very poor coping skills, make poor decisions about their health decisions, and those things can all interfere with treatment and with treatment compliance. Many of the individuals that we serve are disengaged in their health care, and they have social challenges that are problematic, transportation being one of them, as you heard that earlier today. Treatment of mental illness goes beyond traditional therapy and medications. At Frontier Health, we also provide a care coordination service known as case management to individuals with significant behavioral health issues. Case management is a community-based service. It's a recovery-oriented service that relies heavily on a therapeutic relationship with the individual. The case manager often works in the individual's home, in their community, sometimes in their workplace. They're community-based services rather than office services. The case manager operates much like a switchboard operator, where they help that individual understand, coordinate, and access the services that they need in addition to the traditional mental health services that can help improve their overall health outcomes. We help them with housing, employment, and access to their medical services and coordinating some of their medical services. This year, Frontier piloted with Blue Care a program where actually Blue Care came to us and said, we're having trouble with this population getting the necessary preventive services that they need to improve their health outcomes. And they felt that we could use that case management program that we have to help get these folks to their physicians, help their physicians understand what services they need, and improve their treatment compliance. We were so successful with this program in helping people close what's known as HEDIS gaps, their healthcare gaps that lead to more expensive and more costly medical problems, that Blue Care went statewide with this program. So that we know that behavioral health providers can provide care coordination through case management when it's reimbursed, and which can help integrate behavioral health care and primary care services. You heard Linda talk about the need for integrated care. Integrated care can happen along a variety of different venues, but we have to integrate primary and behavioral health care if we're going to have improved healthcare outcomes and improved costs for this population. So those of us in the healthcare industry, we need to continue to find opportunities to partner so that we can treat the whole individual rather than just this piece of the individual or this piece of the individual. And we need to encourage our state to have payment structures and incentives that allow us to partner and allow us to find ways to do a better job of integrating behavioral health and primary care services. So in conclusions, I'd just like to leave you with 2 thoughts. Efficient and cost-effective treatment of individuals requires treatment of the whole person using care coordination efforts, especially for those with behavioral health conditions. And behavioral health providers can improve treatment compliance through funded community outreach and other care coordinated efforts. Again, I thank you for the opportunity to have behavioral health have a voice here at this forum. I think it's critical when you think of the numbers of individuals who use those services and the potential impact that those conditions can have on their overall health care. Thank you.
Good morning. I'm Richard Venable, Mayor of Sullivan County. Honored to be here this morning. Being the only elected official on this panel, I get a chance to brag on my county, and I'll do that in just a minute. I would like to take this opportunity, and I'm sure someone will later, but I wanted to recognize Chairman Rusty Crowe, Senator Rusty Crowe, Chairman Mike Harrison, being here on a 14-degree morning after spending a very stressful week in Nashville. I appreciate your efforts. I appreciate what you do. And I just wanted to acknowledge that before I started. As I say, I'm sure one was going to do that, but they're former colleagues and good friends. So, the Sullivan County Regional Health Department is unique in Northeast Tennessee. We are one of 6 metro health departments in the state. Sullivan County finds itself in odd positions sometime in that we're too small to be big and too big to be small. So we, in this particular case, we're grouped with Nashville, Memphis, Knoxville, Chattanooga, and the Jackson-Madison County area, and Sullivan County form the 6 metro health facilities in the counties. I'll talk about how that allows us to do some things. We have over 100 county employees. That's the first major difference in Sullivan County, is that we do have people who work for the county, and so we're pretty much self-directed. Today I have with me our director of our health department, Gary Mays. Happy to have him here. And speaking of being an elected official, about 25 years ago, by virtue of about 350 votes, I became an expert in all areas. But healthcare wasn't one of them. So that's why I have people like Gary Mays at the county level. I have a slideshow that I will go through very quickly because it's a 5,000-foot view of what Dr. Wyckoff gave us at 30,000 foot. And again, it gives me a chance to brag on our county and gives me a chance to tell you how we hope to improve our county. I would mention that during my first term as governor as mayor, if I hadn't repeated that, you might not have got it, but my mind has been in Nashville this week with all that's going on there. But my first term as mayor, I knew we had an outstanding health department in Sullivan County, the history of it, and I encouraged them to become part of the Tennessee Performance Center for Performance Excellence. And they've been a member of that program for years. And don't be surprised if that health department one day might become the 3rd Malcolm Baldrige Award winner in Sullivan County. So I have high expectations for them, and they set high expectations for themselves. Sullivan County, just to cover a few stats that Dr. Wyckoff has covered, I will compare with the state instead of the nation and the world. There you see our unemployment rate that we are a little better than state, and we lag the nation. Population, we're getting older. 60 to 69 is 24%, while the population of 30 to 39 is decreased by 18.5. That means that Sullivan County is facing a population crisis. We're lagging the state in population growth, and we don't have those young people. We're just getting older as a general population, and that is reflected by our Sullivan County employees. Health access in Sullivan County, we do lead the state in doctors per 100,000. We're at 289. The state average is 246. I think that's influenced greatly by the Quillen College of Medicine, and thank goodness for that. You will see in insurance, which we've talked a lot about this week, that we lag the state in insurance. We have 25% of our people in Sullivan County do not have access to health care insurance, and that's what a lot of the conversation has been about this year. Dental, obviously in the RAM clinics, the biggest used service is the dental access, and again, we lag the state in that. Quality of life. Got 17 greenways and trails, 5 golf courses, 30 parks. And when I was in economic development, this was the biggest recruiting tool that I used. And I'm going to digress just a little bit and tell you about recruiting one industry that had the opportunity to provide over 600 jobs. We'd shown everything we had. We'd fired every bullet in our gun, and we still hadn't closed the deal, and we're standing out on a site in Sullivan County, and the site consultant said, look at those beautiful mountains. He's looking at Holston Mountain. And I'm standing there thinking, how can I close? What can I do? They're obviously interested in environment. And a light bulb went off, and I said, by the way, we haven't built a building yet. I said, we got a par 3 golf course right here. And if you locate your business here, I'll build you a walking trail through these woods. The next day we met at Networks, closed the deal, went into my office. The consultant said, you know what closed the deal? He said, that $20,000 walking trail to that golf course. So quality of life, we're talking about economics and healthcare here this morning, but quality of life is a huge issue. And we think in Sullivan County that we do pretty well there. Health perception, our citizens think, we run a little bit behind the state on how well they think they are. The realities are different than how well we think we are. Behavioral health, Dr. Wyckoff has mentioned this, 22% is compared to 20% in Tennessee. And I'll take this opportunity to mention our state health department, the grants that Sullivan County operates under. We've had, I believe, Gary, more than $250,000 grant. Unlike our friends in Virginia, we spend it on health instead of economic development, and we're happy to do that. And Gary and I have talked about that, and we want to focus that $250,000 on our young people. If they never start, they never have to stop. So obesity and weight, you'll see 34% of the adults are reported obese, 36% being overweight. That tracks Tennessee, but lags behind the U.S., or leads the U.S., if you will. Environmental health. Obviously, we're an industrial area, and here in Northeast Tennessee, we have the highest number of manufacturing jobs of any place in the state. In Sullivan County, I think about 18 to 20%, the state's 8 to 10%. Happy to report that our ozone levels, which are a major health factor, are well within the EPA range. That allows us to recruit industry. When with the new standards that are coming out from EPA, we'll probably be out of the range again, but we'll work to. We've worked with our industries. We've instituted corrections, and we will meet the challenge in that area. Children's health, child mortality rates were below the state level, and a 5% decrease in 2009. Pregnancy rates were less than the state, and those are all important things. A lot of discussion on vaccines and how good or how bad they are, but we do. We have 46% of the Sullivan County adults took the flu vaccine. Pneumonia vaccine, we lead the state there at 29 to 25%. Childhood immunizations, 80% of 24-month-olds and 94% have received their influenza vaccines. What are we doing in Sullivan County? And that's where I hope to brag a little bit, and we place great faith in our ability to face some of the problems we have. Obviously, we want to increase our employees' health status, and that results in better job performance, lower health care costs, which I'll get back to later, lower emergency room visits, which drive health care costs, improve morale, and taxpayer investment, because all of our Sullivan County benefits and all of our Sullivan County health care is paid for by our property tax base and our sales tax base. Back when I was first mayor and not first governor, we found the largest problem we faced in Sullivan County with our employees and our employee health care was diabetes. We became aware of a program in that was instituted by the Human Resource Department in the city of Asheville, North Carolina. And we instituted the Asheville Project, which was a diabetes identification and treatment program. During my absence from that office, for whatever reasons, and this is one thing about being elected officials, you can start something, you're never sure it's going to be finished. It all depends on the elector or where you are in your career. We kept portions of the program, but the education part, the coaching part went away. So we're reinstituting that program. We used to call it the Asheville Project. Now it's going to be the Healthy Sullivan County Project. And on March 1 of this year, we will reinstitute that program with somewhere between 120 and 150 of our 680 employees who will be enrolled in that program. They will meet 8 to 10 times a year with a physician or an RN. We will help them in assessing risk factors and diagnostic testing, getting real-time actionable lab results. I'll mention that. We'll have one-on-one coaching for those 150 people. And as the reason that they're motivated to do that is that for the last 10 years, Sullivan County has been buying their drugs and their paraphernalia for treatment of diabetes. We have been paying for that through our health care program. So they are motivated economically to be there beyond the good health care that they get. So we're starting that again. We continue to pay for, they don't have copays on their insurance. We're encouraging them to come to our Sullivan County Health Department for their care in that area. We think that will bleed over into other areas of problems that are caused by diabetes. If you've lived with a diabetic, you know all the related problems and how important diabetes education is. I've had that opportunity with my family. We were well cared for, but education became the major factor. And as I mentioned, our aging population is going to become a larger factor. People are working longer. So we think this is a timely program, and it's certainly a benefit. The small charge, the small cost of providing no copays and their equipment is more than reflected in the results. This will use our health department and our electronic medical records to help these people have a program of progress, and each person will have an individually styled and designed program for them. And again, that will involve coaching. We've hired an RN, MSN to meet with these people and to we want to become a friend. And as I say, for our 680 Sullivan County employees, we want the health department in Blounteville to become their focus for their health care, because we can assist their primary care physician in keeping them healthy, keeping them out of emergency rooms. Expected outcomes: better control of their diabetes and current and future costs. The next step, after we've identified these 120 to 130, we will continue to provide services for those remaining employees, and one of the first focuses we'll have are the pre-diabetics. That's where we'll save money. We want to work with our employees to determine their healthcare status, and those folks who are A1C is increasing, we want to coach them, give them all the help they need, give them the education to keep them where they are. And believe it or not, if you're pre-diabetic, little health, little diet, little emphasis on that program, that A1C will go down. I'm living proof of that. And obviously that translates into less cardiovascular disease, hypertension, high cholesterol, and all those things that cause stroke and the risk factors. So we expect, we have an accountable, we set this up, we're going to be accountable. We're going to be accountable to our employees, but we're also going to be accountable to the taxpayers. Now you might say, why is this so important? Back when we did the Asheville project, we had a regular premium healthcare plan 2 years ago, and all the benefits that we got from coaching our people and being in this program accrued to the insurance company. Our premiums would have gone down eventually, but we were jumping from one company to another to keep healthcare costs during that term. So the benefits of that program never accrued to us. 2 years ago, we went to a self-insured plan for our Sullivan County employees. So therefore, every time we can keep an employee out of the emergency room and in our health department, out of some emergency treatment, and we can keep them on a regular, scheduled assessment of their risk, we're going to reduce our health costs directly, because as you know, in self-insured, you pay those claims. No insurance company stays in. So could be if we do it right and we work with the pre-diabetics, it's going to accrue to great benefit to Sullivan County. There's a plan too, and that's just a snapshot of where we are in Sullivan County. As I say, we're in our first baby step. We intend and are dedicated to taking larger steps, and it's all directed at better health care for those 600 employees and those 1,400 family members that are covered under our health care plan and certainly impact this economy. Thank you, and I'll be happy to answer any questions.
Well, let me add my sincere thanks to the panel. Thank you for those presentations. As the mayor mentioned, we are very pleased to be joined by a number of important folks in the room, and especially our elected officials. I just want to acknowledge Representative David Hawk is here, Bud Halsey, and Mike Harrison. We're also joined by Senator Rusty Crowe, and Congressman Rowe is represented by Bill Darden, excuse me.